What's up, guys? Dr. Chris Park here, and I want to clear up a misconception that is running rampant. And you know, I don't know if I was part of the problem. I put out a video a long time ago about how to taper off Suboxone, and of course, I get a lot of people who are trying to taper or trying to quit, etc., that have been interested in that video. But the truth is, you don't have to stop Suboxone. You don't have to taper off, okay? There is no, like maximum time period to stay on medication assistance. Now that's going to get a lot of people upset, okay? Because, I mean, the internet is a dog and pony show, guys. Everybody is pushing their opinion, and yes, I guess I'm pushing mine. But I'm telling you, in the world of addiction, particularly with opiate addiction, we've never had, opiate use disorder, whatever. We've never had a medicine that worked this well for anything other than maybe like Chantix for smoking. Now, we all know that like these medicines can have side effects and risk, and obviously the lowest effective dose for the lowest amount of time is appropriate for any medication for any condition, right? But there are people who, develop heart failure, and they're probably just going to have to stay on medication if they want to optimize, right, their heart health, okay? It's not because I just want to put everybody on pills or everybody needs, it's about optimizing your life. Now, if you can live an optimal life off Suboxone, and that means you're having healthy relationships, you're not going back to opiates, then more power to you. And a lot of you are at that point, but some of you are not, okay? All right, some of you are just now getting your life back together, and maybe you don't need to taper. One thing, when they did these early studies with Suboxone, and they would use it just to detox people, they had increased death rate afterwards. And it's because people were using it, they were detoxing, they were then relapsing, but they didn't have their old tolerance anymore, right? They had lost their tolerance. So they went back to the same amount of drugs they were using, whatever, how much heroin that was, whatever, and they were dying, okay? So it's thought, well, a safer method is just maintenance therapy, continued maintenance therapy. Now, the other thing I want you to know is that I don't typically taper people off in 16 weeks. I know I did the video in 16 weeks, and I told you in that video that would be the fastest I would do if I was like forced to do it, right, from a high dose to low dose. But I think that's not good for most people, okay? Most people need a very slow taper, all right? Allow your brain time to readjust and reset. And that's it, man. That's the main thing I want to share today, guys. You don't have to taper. I don't care what the crazy yahoos in the comments section say. If you're on Suboxone, you're prescribed by a doctor, you're taking as directed, and you're not shooting up heroin anymore, it's a win. It's a win, okay? Now, if you can get yourself in a better place in life and you feel like, hey, that you can start the process, then you start to slowly taper and you see where you're at, and you can stop at any point and say, man, I don't feel comfortable tapering lower at this point. That's okay. It's a win, So take what you can get, guys. It's not optimal. Obviously, everybody wishes they could live to 100, no medications, fit as a fiddle forever, and then just kind of whatever. But it's not going to happen, right? We're all going to have different conditions and medical problems that we're going to face. I mean, this life is a struggle, but it's not, there's nothing wrong with getting help. And if you need medication to help you, that's okay, all right? It's not a moral failure on your part. All right, guys. Dr. Chris Park, hope that was helpful. Have a good day.